Mads, it's always a pleasure to have you on. And I always start with you with the same question, because you know people in Gaza, you've trained as doctors there. What is the latest that they are telling you? They are giving you their testimony. Give it to us.
Well, two things. Number one, that these so-called food distribution points have been used as a trap to attract starving people, only in order to shoot them, maim them, and kill them. And the majority of those they received were shot in the head and the chest. Deliberate killing and execution of starving people. Number two, the situation in the hospitals is extremely difficult. It's basically only Nasser and Al-Aqsa Hospital working now. Al-Aqsa has been bombed today. And in the north, there are, practically speaking, no hospital healthcare at all. This has been going on for 600 days and more. And it has been enough talking, they say. And they also ask me, why, Dr. Mads, is it that the world is not stopping Israel? Why is it that European governments and the Western governments are not stopping Israel? Are we seeing the introduction to a new era of humanitarianism, where humanitarianism is allowed to be used as a weaponized tool of conquering another country and of occupation? That's the critical questions they ask me.
Mads, it's a slightly political issue, but it always becomes one in this current conflict. In terms of, you're saying that a lot of people in Gaza are complaining that the world is not calling out Israel enough. For those countries who aren't doing that, have they bought into the dehumanization that Israel is imposing upon the people of Gaza? Just with these aid deliveries, we're talking about possibly old and infirm people, people who are already hungry. There are kids whose ribs are sticking out. They're walking 10, 20 kilometers. If they're lucky, they get a box. They have to carry 20 kilos back to their shelters. I mean, this is about the dignity of human beings.
Absolutely, absolutely. And it's not only about calling out Israel, it is all about stopping Israel. Had this happened, these atrocities, these dehumanizing scenes that we have seen in Gaza for more than 2 months now, had this been happening to white people with blue eyes and blonde hair, it would have been stopped in one day. So this is a deeply racist picture that we see, that the Western governments, and I'm sorry to say the Arab governments, by and large, are willing to, and letting Israel continue this ethnic cleansing. Now, listen, humanitarian aid is non-negotiable. We have international mechanisms to supply people in dire need, be it from an earthquake or from a war. The situation in Gaza is 100% man-made by the Israeli government and the occupation army. It can be stopped very quickly. But the Western governments are allowing this to happen. And I fear very much now, as a doctor, and I worked with international relief for more than 40 years with solidarity medicine, I fear that we are entering into a new time now where the whole international setup is dismantled by the US and Israeli alliance, because we have mechanisms. We have the World Food Programme, we have the WHO, we have not at least UNRWA. And Guterres, the Secretary General of UN, just said a few days ago that UN has the equivalent of 9,000 truckloads with food, water, and essential supplies waiting outside the fence around Gaza. And the Israelis are not allowing it to come in. And now this latest turn that they use these food parcels, and it's only a few, as a bait to attract people, only to let the Israeli army kill them and maim them, it is beyond comprehension. And like we saw from London, all the good people on this globe are against it. And we demand an immediate stop, an immediate opening of Gaza, so that our fellow men, women, and children there can have the food and the dignity and the supply of medical services that they deserve, just as much as I deserve it as a white doctor in Norway.
Listen to this, Mads. It's from the International Committee of the Red Cross, a document of theirs. And it says, while international humanitarian law contains no mention of the right to food as such, Many of its provisions are aimed at ensuring that persons or groups not or no longer taking part in hostilities are not denied food or access to it. In other words, either Israel believes that Gaza's women and children are combatants, or it doesn't care, it knows that they're not, and is killing them on purpose. Because this says if you're a person no longer taking part in hostilities or have never been part of the hostilities, you can't be denied access to food.
Absolutely. And, you know, to be blunt and rude, Israel doesn't care a shit about international law. They do exactly what they want as long as they have the backing of the United States government, which they unfortunately have now. And they have all this talking from the European governments. Don't forget that serving partner to NATO. NATO has never condemned the way that Israel is waging warfare, if you can call it that, on Gaza. So this is, in a way, a systematic breakdown of these standards that you are pertinent referring to, because any of us who are human beings, we would say that starving people should have food and water if it is available. And in Gaza, it is available. So as I said, 600 days of misery, 600 days of attacking, more than 400 attacks on healthcare, more than 1,000, more than 1,200 killed healthcare workers. Almost all the hospitals in Gaza are destroyed or closed down because of lack of fuel, water, services. This is a systematic killing of a whole people. This is the settler colonial occupation of Palestine, and it's allowed to happen. And we watch it on our phones from second to second. So I think we are at a breaking point internationally now, where we risk that whatever order we have maintained after the Second World War is being torn apart and thrown out of the window by Israel and the United States, and it's bad news for all of us. So what's going on in Gaza and the struggle that the Palestinians are fighting against the occupational army of Israel, it's a struggle for all of us, because it is, at the end of the day, a struggle for human rights, humanity, and decency on this world.
Dr. Mads Gilbert, thank you so much.
Thank you.